Hello, my name's Tania Sorrell and I'm here to tell you about mycology and some of the issues that we have to deal with in Australia. There are two areas of importance. One are the sorts of diseases which affect the skin, those which are very common like tinea and maybe vaginitis, which obviously affects the female genital tract. But the ones with which I deal mostly are actually those that cause invasive disease. My home base is the University of Sydney at Westmead Hospital, which is about 26 kilometres to the west of the city. And there we have a large fungal infection group which is joined together with others around the country in an initiative known as ANZMIG, which is the Australian and New Zealand Mycosis Interest Group. Through that group we've been able to do a number of studies trying to define what are the important invasive fungal infectious diseases that we need to be most concerned about, that we can do research on in order to develop better diagnostics and to understand the best treatment options. We've done a number of studies over the years ranging from cryptococcosis, which is my major research interest, ranging from there through aspergillosis and candidiasis, and in particular candidemia in intensive care units has been a focus for us. Within Australia there are a few invasive infections which are a little different from most other parts of the world. One of them is that disease is caused by a certain species of cryptococcus called Cryptococcus gattii, which has been associated with eucalyptus trees as the environmental source. Inhaled by humans, it causes lung and central nervous system disease, much like its cousin, Cryptococcus neoformans, which is the one that causes infection in patients with AIDS. We also see another fungus called Scedosporium, which is relatively uncommon in many parts of the world, with the possible exception of Spain. Why it should be a problem in Spain and Australia particularly is not clear, but certainly the climates are similar, and perhaps that's got something to do with it. I'd like to talk a little bit about some other infections though that are potentially more important in our near neighbours rather than in Australia itself, and one of those is fungal keratitis. Keratitis affecting the cornea of the eye leads to blindness. We see it in our setting most commonly, even though it's rare, in association with corneal lens infections. But in our neighbours to the north, in Indonesia in particular, but also Papua New Guinea, the Asia-Pacific region, it's a common cause of blindness. Not the most common, but because rural and remote farmers working in agriculture often injure their eyes, they may not have access to medical care to deal with those injuries. They become infected, firstly with bacteria and then with fungi. And those fungal infections, which are often due to an organism called Fusarium, can lead to blindness. It's really important that we are able to educate and train people in these areas to diagnose this infection quickly and to have access to the drugs and to be able to use the drugs that will actually help cure that kind of infection. There are a number of other fungal diseases that we're aware occur in developing countries, but we have no idea as to the extent of most of these diseases because the diagnostic capacity is not there. One of the issues that we would like to put forward through this Gafi initiative and through my own institute, which is the Mari Bashir Institute for Infectious Diseases and Biosecurity, is some laboratory capacity building and training programs for remote areas, for developing countries, particularly in our regions, but obviously not confined to that.